No, you're not supposed to.
Hello, my name is Pamela Gaines, and I'm presenting to you my senior class project adhering to the Modified Early Warning System score. What is the MEWS? The MEWS is a modified warning system that is developed to identify early deterioration and prevention of unforeseen events within the patient's clinical course. The MEWS score encompasses the respirations, the heart rate, systolic blood pressure, conscious level, temperature, and hourly output. The MEWS has a rating system of 0 to 2, meaning to continue the vital signs as normal, a 3 to 4, in which the charge nurse is notified, and you increase the vital signs from 2 to 4 hours. With a MEWS score of greater than 5, then the STAT team or the RR team is called, and they start the algorithm of every 1 to 2 hour vital signs. But root cause problem continues to exist within adherence of the MEWS, and that the nurse does not chart during busy periods, and she does not follow the algorithm. But the result of this is the decreased in patient outcomes with increased morbidity rates, and the length of stay increases with adverse outcomes and poor outcomes for the patient. It also affects the nurse in that she has no or he has no set guidelines or parameters and uncertainty regarding skills and assessment. And eventually, the nurse experiences burnout and fatigue. But why should a change be made? According to the Institute of Health and Improvement, the agency has challenged hospitals in the United States to implement a response team in conjunction with the MEWS score and nursing clinical assessment to reduce the cardiac arrest, to reduce reduction of morbidity, decreased length of stay, quality of care concerns, and to reduce untoward events. What needs to be done to correct the problem? We need to educate. We need to change thoughts and feelings and behaviors regarding the MEWS adherence. We need to allow the nurses to express their concerns regarding barriers to adhering to the score by unfreezing, change, and refreezing thoughts. We need to provide staff support, management involvement, and benchmarking and collecting data to show that we have ownership in the process. So here comes the MEWS, the process of saving lives. So clinical research has taught us through several clinical trials, one taking into account a 900-bed hospital facility, that their sole purpose was to identify parameters to the MEWS and detecting subtle vital signs and changes to detect early detection. The findings showed an overall reduction in cardiac deaths occurred with implementation of the MEWS. Another study with a 520-bed acute care facility utilized improvement projects and review of standards, focused findings on basic tools in current published literature. In this implementation, the MEWS tool, an algorithm implemented for elevated scores, showed an improved way to identify patients at risk for deterioration. Lastly, the third research finding was a single descriptive and qualitative study with the purpose to explore root cause analysis and elevated inpatient mortality rates. With the implementation of the MEWS, the number of the code blues and incidents decreased with an increased number in STAT RRT calls or STAT team calls. According to the National Clinical Effectiveness Committee, was established as part of the Patient First Initiative. This was clinical guidelines to optimize patient care. And the study of the MEWS, evidence with baseline audits, strengths, and weaknesses in literature review, showed the significant impact of the MEWS score on avoiding patient deterioration. So with all these outcomes and the implementation of the MEWS, we're going to have improved communication with our doctors and the nurses. We're going to help the nurses prioritize their care. We're going to have a decrease in cardiopulmonary arrest, decrease mortality rates, improve patient satisfaction, and the decrease in length of stay. So in order to keep us focused on improving these MEWS scores, we're going to need quarterly monitoring, quality improvement initiatives, rewards and monetary gains. We need to have benchmarking data, and we also need a quality improvement committee who oversights all these information. So what is my personal obligation to change, and how will the change affect me and the care that I provide? So I can envision through the unfreezing and change and unfreezing thoughts and ideas for the better patient care and outcomes is definitely important. With the implementation of the MEWS and adhering to the recommendations regarding vital signs and parameters with the algorithms, with early notification can provide patient better care for patient outcomes. Quality and safety should be the ultimate goal of providing patient satisfaction with the improved quality of care. Teamwork is the key of adherence to the MEWS. Thank you. Sorry, guys. I got all stumbly.